Hi, my name's Vicky Kirby and I'm doing this vlog to show you my experiences of working for the Immunisation Management Service as one of the regional heads. I'm a regional head for the North West, which covers South Cumbria, Lancashire, Cheshire and Merseyside and Greater Manchester. And I've been doing this since autumn last year, where initially we were looking to push up the rates of vaccine take-up for seasonal flu. And this year that's become COVID. I don't just work for South Central West. For 2 days a week, I also work at one of the local mass vaccination centres as an operational lead. And I've been very lucky that South Central West have allowed me to drop my hours while I do that. This big bag is not full particularly of computer stuff or anything useful. It's full of food because the local centre is in a football stadium in the middle of nowhere and it's a 12-hour shift. And I really don't want to run out of food when I'm there. I also have to make sure before I go that I've done my lateral flow test so that we make sure that everybody turning up to the stadium is COVID free. So that's what I do just for 2 days a week. And it works out really well. I feel that it gives me the 360-degree view of vaccinations for COVID, not only in the delivery in the vaccination service centre, watching a lot of people being very relieved to finally get their vaccine, but also working with those regional centres to drive up the vaccination rate. We also work with the CCGs and we work with screening and immunisation teams. Any of those people who are in a position to make sure that those people get access to that vaccine and make sure that it's a more successful service. We try and present the data in really visually interesting ways, so trying to make sure it's the data that they need specifically rather than having to go to lots of different sources, and there's 3 of us in our team that were able to give them that individualised work, and we also accompany it with analysis for whatever need they have. There's a really big push at the moment to look at how we can push up the rates of vaccines for those marginalised groups. So it might be those in deprived areas, or it might be some areas of inequality or ethnic breakdowns. And it might be even now looking at more at gender as well as those marginalised groups. We're hearing lots of really innovative things that go across the whole country. And the nice thing about being part of a regional team is that we listen to our other colleagues across the country and we can feed that back regionally in what's happening. And it might be that there are boats delivering vaccines in somewhere like Bristol. We've got ambulances in Oxfordshire. We've got women-only clinics. We've got quiet clinics for those with learning disabilities. And we can share that with our regional teams so that they're able to take that information back to their areas. And I think one of the other very unique things that we have for South Central West is that we have the qualitative data that we get from the recall service. So from that service where they phone up those people who haven't yet taken up a vaccine or haven't yet booked a vaccine, we're able to get that really interesting local data saying what it is that's stopping them from doing so. And we can feed that back to our regional areas. And it might be just that there's some misinformation going around, and then they can do some really tailored communications with their communications team to say, this is what we're hearing is happening, this is what's stopping you, this is in fact the facts. And we can give them that data by ethnicity, by deprivation, by CCG, really small groups of people that are feeding back, this is what's stopping me taking up this vaccine. And then we know what sort of information that they need to help make it possible. So thank you very much for listening to me. And if there's anything we haven't answered and you'd like to have answered, do get in touch. And if you found this interesting, let us know. Thank you.